let's talk a little bit about the nitty-gritty of what patients can expect and what they can do. So firstly, how can patients prepare for a telehealth visit? So what can they do to help make the doctor's job easier to tell, whether there's something bad going on or if everything's okay? Can they do anything to prepare?
Absolutely. So I kind of look at preparation in various ways. So there are preparing the circumstances to maximize the benefit of their encounter, and also obviously the information communication element as well. So fundamentally, any virtual encounter really requires a subset of things to make it an optimal encounter. So if you're video conferencing, being able to test your software and network connectivity prior to the encounter. Most video conferencing software has testing functionality that people can reference and use to make sure that their hardware and software is working properly and that they're able to connect with their provider with relative likelihood during the actual visit.
Yeah, and that actually means that there's at the bottom of every invitation that you get, when you get your invitation for your appointment, at the bottom there, it'll say, if you've never used this software before, test to make sure you're able to use it. And it's really important to be able to do that to make sure everything is set up before the visit.
Absolutely. And different programs have different abilities to do that and different processes, but fundamentally there's always, it's always an advisable step. The other part of it is just making sure that you have the physical environment around you that facilitates having an ideal encounter. So make sure you're in a quiet place. Make sure that you're ideally not interrupted during your visit. You have elements of privacy around you, such that your information is not being disclosed where it shouldn't be disclosed. Also, just making sure that you have updated information related to your physician's contact information in the event that you need to get a hold of them immediately prior to the encounter. Make sure that you have all your medical history and your medication lists with you, itemized ideally, and just ready to go in reference during the encounter. The other thing I always advise is having a thought about the specific questions that you want to ask your provider during the encounter. And it's one of those situations that when we're in the moment of an encounter, it's very easy to forget the things that we wanted to discuss. And after the encounter, having those moments where you're sort of fretting about the fact that you didn't ask one thing or another. So writing these things down, or at least committing some sort of dedicated thought in advance to the encounter, and having these things listed really comes in handy. The other, sort of along those lines, making sure that you really have an itemized sense of your symptoms and things that are important to you in thinking about certain patient-reported outcomes and some of the elements of your health related to either physical parameters, emotional or social domains that may come up during discussion and actually may provide some basis of important information for your physician to actually know how you're doing and really get a true sense of assessing your disease activity and also the quality of life impact that it's having to you. And along those lines, thinking about some of the specific information, for example, as Dr. Wang's Harvey Bradshaw Index scoring system demonstrated, and things that your provider may actually need to be able to assess your disease activity on a scoring scale in a way that is meaningful and helpful in assessing your disease.
And maybe that's actually a good point here.
I should just also add, it's also very helpful because if we have a sense that you are having very severe disease, it may prompt us to really push towards an OTN video conferencing versus a phone call visit, just because there's actually a lot you can learn from video, even without a physical exam. Looking at how sick you might feel, it gives us a good cue for that. And so it helps us prepare better if you have an opportunity to complete those forms beforehand, so we can prepare on our own and more for that particular health encounter.
And it's worth noting that OTN is an Ontario thing. We've got lots of people from outside of Ontario here at the webinar, but there's lots of different solutions out there that are being used by physicians, and the provinces have become more supportive of allowing us to use things like Zoom or FaceTime, despite them perhaps not being as private and secure as the official provincial methods of communication. It's important for the patients to realize that it's not as secure as potentially, and I'm not talking about the healthcare Zoom version, but the commercial Zoom may not be completely secure. But if it's between that and not seeing your doctor at all, I think most people would prefer to use, one of these teleconferencing, video conferencing solutions.
And certainly if people are consented for that and understand the risks related to the disclosure of their information, it's quite acceptable to do so, for sure.